there, Cyril Ramaphosa. As we noted, it is the Johnson & Johnson vaccine that he is taking. The AstraZeneca vaccine, which was brought to South Africa earlier this month, will then be sent off to the rest of the African Union at no cost to the fiscus, which of course is quite critical as well for an economy like ours, which has continued to struggle with high debt as well. So President Cyril Ramaphosa, as you can see there, being briefed as well as he arrives at the hospital with onlookers there, the healthcare professionals, as well as Health Minister Dr. Zweli Mkhize there. Of course, Foreign Editor Sophie Mukwena also still standing by. There's the President there as well. So very important, isn't it?
Indeed, very important. You can see that the health worker is assisting the President. He is currently filling the form to ensure that he is documented in terms of people who have received the vaccines, because you have to keep this information and also do follow up, because sometimes people are experiencing the after effects, like any medication or any vaccine. You'd recall when we were still learners at school, when we received the vaccines, there were some effects and sometimes you wouldn't even be able to go to school. Therefore, the medical team of the President, because he's got a medical team, they will then monitor progress and to ensure that they are aware how he is responding to the vaccine. And this is going to happen to all people who are going to receive the vaccines. They are going to keep records so that they can do follow-ups, particularly with vaccines where you have you take a first dose and a second dose. They will keep track so that they can do follow-up to ensure that you go for your second dose. But in this case, it is a Johnson & Johnson vaccine. You don't need a second dose, and therefore the President will just take this Johnson & Johnson vaccine. There is the President, and health workers are currently helping him, and very soon we will see a health worker administering that vaccine.
Yeah, Sophie, thank you so much for that. As you can see there, the rolling up of the President's arm there as we get ready to get that jab into his shoulder. Then President Cyril Ramaphosa said to receive that vaccination there for COVID-19. It is a Johnson & Johnson jab. Indeed, a jovial President there. It's been a long wait. It has been an onslaught, a big struggle, and certainly a difficult time then for the country as well, as we continue to try and find a way to forge through there, as he is now set to receive a jab there, the President there. And as you can see, there it goes, the President Cyril Ramaphosa getting vaccinated for COVID-19. And we continue, of course, to follow through. We of course continue to follow through these images as things continue to come through. As we noted, then there is 80,000 doses of the Johnson & Johnson vaccine that was received. Then 17 vaccination centers have been identified, particularly for the rollout of this vaccination in the Eastern Cape, the likes of Livingston Hospital in Port Elizabeth, as well as Nelson Mandela Academic Hospital in Mthatha is set to receive the Johnson & Johnson vaccine, or is part of the vaccination centers, as we see the President Cyril Ramaphosa there walking out, of course, and thanking the healthcare workers, having just received his inoculation jab there for COVID-19. Some of the other vaccination centers, as I said, 17 of them around the country. The Free State Pelonomi Hospital in Bloemfontein, as well as Universitas Hospital in Bloemfontein, will also be a vaccination center. We'll also, in Gauteng, we'll have the Chris Hani Baragwanath Hospital in Soweto, as well as the Steve Biko Academic Hospital in Pretoria, will indeed get or become vaccination centers. KwaZulu-Natal will have Inkosi Albert Luthuli Central Hospital in Durban and Prince Mshiyeni Memorial Hospital in Umlazi indeed get the inoculations as well. well, and the jabs will certainly be sent to them, and they'll have be part of the vaccination centers. Of course, the hope here is that a whole lot more of the Johnson & Johnson vaccines, or perhaps others that are deemed sufficient for South Africa and the variant indeed found in the country, we will find the vaccinations sufficient to help South Africa curb the virus and its spread any further. As I noted, still with regards to the 17 vaccination centers, you go to Limpopo, where the Pietersburg Hospital in Polokwane, as well as Mankweng Hospital in Polokwane, will also be receiving jabs as well. There we have the Health Minister, Dr. Zweli Mkhize, also set to receive his inoculation there for COVID-19. Quite critical, of course. We do know that the Health Minister did get COVID-19 as well. So it will be interesting to also just see how this plays out, and what exactly works and doesn't work, how it works, how efficient. Of course, the efficacy has certainly been quite important of late. Dr. Zweli Mkhize, the Health Minister of the country, certainly getting that jab there as well. So very important to see that change, to see that progress being put forward there. We are, of course, in the Western Cape, in Khayelitsha, to be exact. That this is where the first jabs of the COVID-19 vaccination are indeed taking place, and we are covering that for you live. If we stay in the Western Cape, some of the other vaccination centers in and around the area, the Groote Schuur Hospital as well as the Tygerberg Hospital, both in Cape Town, will both also be vaccination centers for the country. In Mpumalanga, we have the Rob Ferreira Hospital in Nelspruit and the Witbank Hospital in Emalahleni. There you have it then, the Health Minister getting his jab as well. Still, of course, with the masks on, as much sanitizing as possible. And South Africa hopefully begins its road forward then in the fight against COVID-19. General practitioners, as we've noted, have certainly been very critical and important to how the inoculations take place, what exactly happens for the country. The visuals, I suppose, speak for themselves, but the healthcare workers, the frontline workers, people who will certainly be taking care of the country for the most part moving forward, will certainly be the ones who take the jabs first and will be looked at to really take South Africa's fight a whole lot more strenuously forward as we try to continue this fight against COVID-19. Difficult, the process has taken long, but indeed here we are. We're finally getting those inoculations happening there as well. President Cyril Ramaphosa, as we saw a little earlier, taking the inoculation. Dr. Mkhize as well getting those jabs too. All right, very important and significant moments there, as we noted, the healthcare workers, and you can see also critically an EMS worker as well. They're getting a jab too for COVID-19. We're hoping to get a sense of just how many people will be inoculated today and how the process sort of moves on from here. What happens after this 80,000? Do we begin to receive more Johnson & Johnson vaccinations, or is this sort of the end for now? And what happens? Of course, more than 1 million healthcare workers across South Africa need to be vaccinated before we move on to part 2 of the inoculation process, where critical workers, South Africans with, of course, with some other diseases as well, and infections that they may face critically, will also have to be inoculated. Healthcare workers, a further 200,000 more doses has indeed been promised, so we are indeed waiting for those, and whether those will come to the fore and just how quickly that will happen will change and will determine just what happens with regards to the spread of COVID-19 in South Africa. Of course, the less it spreads, the better. That is all we're looking to try and get to, of course, having seen that 1 million AstraZeneca vaccine doses, unfortunately, not work for us. All right, then we're going to continue then, of course, to try and get some more guests then as well for you to try and unpack this a little bit more and try to give you a sense of where and how important a moment this really is in the big scheme of things. Professor Landon Meyer is the director and head of the School of Public Health and Family Medicine at the University of Cape Town. Professor Meyer, thank you so much for your time as well this afternoon. Just tell us in your words just how critical and important this moment is. How much relief comes to you when you see these inoculations?
Yeah, I thank you for the invitation to be here. This is, my perspective, a monument. Moved from the start of the epidemic to having an efficacious vaccine available today and being rolled out to the general public. Really feat both of scientific achievement, but also public health responsiveness, and I think South Africa can be deeply.
Professor Meyer, just struggling with your line a little bit there. I think it's actually Professor Meyer. My apologies. Professor Meyer, we are struggling just a little bit with the line. It does seem to be crackling. So hopefully we can really just get back to you and speak really directly about the impact this will have just on the medical profession and just how significant it is that something like this now happens, healthcare professionals being looked after to be the first ones to get inoculated, and the process sort of moving on from here. Does this create a sense of encouragement? I mean, confidence perhaps lifted a little bit within the medical profession as well, having seen this come to the fore?
Absolutely. I think it really to public sector healthcare workers in our country, of government to protecting our frontline healthcare workers. The role that these frontline healthcare workers play, it's not just a response to COVID-19.
Yeah, we're just seeing the president there, President Cyril Ramaphosa, exiting the area there. Then, of course, that is where the inoculations are indeed taking place. So we're just seeing him exit, of course, having just had his jab as well. Another EMS worker, as we noted earlier, saying that they are getting the jabs right now. So really significant and important moments. I suppose what will be even more important is the first inoculations of the general population, because that is where the real recovery is then, Professor Meyer, isn't it?
Yeah, I think so. I think it's the next step. Right, prioritizing frontline workers with, and in the future phases when we get to, I think that's when we'll really start to see the impact of the vaccine.
Yeah, so unfortunately we're struggling just a little bit with the visuals. Professor Meyer, even your line as well, also a bit of a struggle there, unfortunately. So we'll try and get some clarity and clear things up as well there with regards to that, and hopefully get a sense and a word perhaps. My colleague Bulelani Philip is indeed in Khayelitsha as well, continuing to follow this one for us as well. So hopefully we'll get to cross to him there, seeing the president depart the scene, if we want to call it that as well. Let's go straight to my colleague Bulelani. The sense then, do you feel a sense of optimism? Is there a sense of jovial nature outside there of the hospital as the president gets his jab as well and now begins perhaps to exit and thank all of those around? Not sure if we're getting my colleague Bulelani Philip, who is out in Khayelitsha following this story then for us. So unfortunately, right now, not getting through to him. But very interesting then. Of course, we've seen now of late the politics get involved at a time like this, where you've seen the likes of the EFF say they want the process with regards to the procurement of these vaccines to be made public in order to avoid any form of corruption that they feel they have seen as well with regards to the purchase of public of protection equipment as well there. As you can note, just outside then the hospital in Khayelitsha there, as you note, the president indeed taking a little bit of a walkabout and perhaps thanking staff as well, thanking all those around to try and give thanks to them. My colleague Bulelani Philip standing by with this one as well. Bulelani, perhaps sentiment and word to be said then from the president. We are expecting a few words from him, aren't we?
Colleagues, we have about 5 minutes. President has to get to Parliament. Thanks for coming.
I'm not sure if my colleague can actually hear me there, Bulelani Philip. As you can see, still a bit ready there as well. We are expecting perhaps a few words from President Cyril Ramaphosa and the Health Minister there, Dr. Zweli Mkhize, as well as the Health MEC in the Western Cape region. That's Noma French Mbombo as well, being part of the entire contingent there, of course, when it comes to the first inoculations to indeed come through for South Africa, having received the 80,000 jabs. Hopefully we can get some word from them there. Let's listen in.